So question number 25. Name the above implant and give it use. Here we can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 hole. So this is called the 10 hole. And broad, as the hole is zigzag, it is called broad. 10 hole broad dynamic compression plate. And it is used for in open reduction internal fixation of adult femur fracture. Question number 26. Identify the above implant, construct being used, and give its one indication for use. Here we can see the external fixator, and the external fixator is used in the open fracture, when the wound is contaminated, in the pelvic fracture. Here we can see this. What are the above given deformities and name the associated disease? So the flexion of the DIP and the extension of the PIP is the swan neck deformity, and opposite of this, where the flexion of the PIP and extension of the DIP is the boutonniere's deformity, which is seen in the rheumatoid arthritis. In rheumatoid arthritis, there is morning stiffness, and disease modifying anti-rheumatoid drugs is given. In rheumatoid arthritis, all the joints is involved except the DIP. DIP is not involved, but the deformity is seen in the DIP. Question number 28. A person falls asleep on a chair and next morning develops this condition. Name this condition and which nerve is involved. Here we can see the wrist drop. So the condition is the wrist drop, and wrist drop when the radial nerve get injured it is called there is the wrist drop. When the radial nerve is injured, there is the wrist drop. Question number 29. A child develops this fracture after fall while playing. What is your diagnosis and what deformity is he likely to develop later in life if left untreated? Here we can see the lateral condyle fracture of the humerus, and the deformity we seen is the cubitus valgus. But in supracondylar fracture deformity, cubitus varus deformity is seen. Question number 30. A driver sustains this condition following dashboard injury. What is the diagnosis? Here we can see there is dislocation. So this is the hip dislocation. Most likely this is the posterior dislocation of the hip. As in dashboard injury, there is the posterior dislocation of the hip, and in the posterior dislocation of the hip, mostly the sciatic nerve is injured. So which nerve is involved in this condition? Sciatic nerve. Question number 31. Identify the above instrument and mention its use. This is the depth gauge. This is used for the screw size determination. So depth gauge and used for the screw size determination. Question number 32. Which sign is being elicited? Froment sign. Muscles adductor pollicis longus, which is for the ulnar nerve. This is the cubitus valgus deformity. Name the deformity shown in the above picture, cubitus valgus deformity, and which neurological condition is associated with this deformity? Tardy ulnar nerve palsy. When there is lateral condyle fracture of the humerus, there is cubitus valgus deformity, and it is associated with and there is the tardy ulnar nerve palsy. Question number 33. So threaded, whenever we see the threaded part in the center, this is the Denham's pin, and it is used in the skeletal traction in the cancellous bone. A newborn baby has this deformity. Here we can see this. Yeah. So what is the diagnosis? Congenital talipes equinovarus, club foot. And name the casting method in this correction deformity. Kites method, which were used earlier. Ponseti method. So Ponseti technique. What is your diagnosis and what deformity is observed in this condition. Here there is the fracture of the radial styloid process. So this is the Colles fracture, and dinner fork deformity is seen in the Colles fracture. Name the muscle. This is the biceps brachii muscle, and which nerve innervates this muscle. This muscle is supplied by the musculocutaneous nerve. What is the diagnosis? Here we can see this is the intertrochanteric fracture. 60-year-old lady falls down while walking. What is the diagnosis? Intertrochanteric fracture. What will be the attitude of injured limb on clinical examination? Shortening and externally rotated limb. Identify the above instrument and mention it. This is the bone tap, and this is used for tapping before insertion of the screw. Which test is being performed in the above picture? Which structure is being tested? This is the Latchman test. Latchman test is done for the anterior cruciate ligament injury. Latchman test is done in 20-degree flexion. So in anterior cruciate ligament injury, mostly performed test is the Latchman test, because as it is done only in the 20-degree flexion, and another is the anterior drawer test, which is done in the 90-degree flexion, and when there is acute inflammation, the patient will be unable to fold the flex the hip, flex the knee joint for the 90-degree. So that's when test is done. Identify the structure marked by red arrow, and compression of this structure in this closed space leads to a condition known as, this structure is the median nerve, and when the median nerve get compressed, the cubital tunnel, carpal tunnel syndrome is a condition. Name the above implant and give its use. This is the Sands pin, and Sands pin is used in the external fixation. Name this condition and which nerves are involved. This is the complete claw hand, so the ulnar and the median nerve is injured. A 70-year-old lady who is community ambulator falls down while walking. What is the diagnosis? Here we can see the fracture. So neck of femur is getting fractured. You can see this fracture. Here see. The neck of femur is fractured. And what is the best treatment to this patient? Hemiarthroplasty or total hip replacement. Identify the above implant and give its indication for use. This is the dynamic hip screw, and it is used in the intertrochanteric fracture. Identify the above instrument and mention is used. This is the Humans retractor. It is used for the soft tissue retraction. In question number 47, what are the structures passing through first dorsal compartment? In first dorsal compartment, two structures pass. Abductor pollicis longus and extensor pollicis brevis. And impingement of these two tendons is called the de Quervain's disease, de Quervain's tenosynovitis. So, the stenosing tenosynovitis of this compartment is known as de Quervain's disease. So, this is all the 47 questions we solved for the ortho OSCE. Thank you.